Okay, thanks a lot, Sandrine. Let's focus for one moment on the word new generation. Every time that we hear these two words that are very much used nowadays, we think of something that is coming and it's fantastic, replacing something that, on the other hand, is not as useful anymore. This is true for equipment, because equipment gets old. And I'm afraid that this is also true for people. Don't even dare to tell that you do not recognize me. This picture was taken quite a few years ago. And a couple of days ago, one of our embryologists told me, how old were you when this picture was taken? Well, I look at her very badly. But anyway, this is where we are going. So new generation is coming. There is no doubt that throughout these years, a lot of new techniques, new advances entered our field in bringing to the situation that we are nowadays, with the 7 to 8 million children born. So I think it's a tremendous success. But the question is clearly, do we still have room for improvement? Can we really hope for a new generation embryo, meaning for new generation embryo that we are going to have a more or less 100% successful implantation, provided that the embryo lands in a moon, as Carlos was saying, that is a beautiful moon, full moon, very receptive, very keen on receiving the embryo. So what can we say about this? Well, I will mention just a few factors. Of course, there is no time for going through all the other many possibilities. So, of course, we can work on culture conditions that have to provide our embryos with the best parameters for being viable. We can work on selection systems, because we want to be able to select the best embryo in the shortest time possible. And then, of course, one of these selection methods can be pre-implantation genetic testing. Then is a sort of mandatory technique to be applied in the cases of carriers of single gene disorder or translocations. But in this respect, I was intended to refer mostly to pre-implantation testing for aneuploidy. So culture conditions. These are the beautiful incubators that we have nowadays, and provide very stable conditions to the embryo that are cultured. And we know that, as Laura was mentioning a couple of hours ago, that low oxygen concentration is what we currently believe it's probably the best to obtain. And this is based on some results that have been reported in the literature. This is a Cochrane review, but it's, well, quite strange review, because it's only reporting the result from 3 studies that anyway claim the low oxygen concentration culture to be the best one for having improved live birth rates. On the other hand, more recently, we had a systematic meta-analysis in which more studies were included. Of course, no need of going through the numbers that actually are not even very clear, but just to the last part over here, in which it is reported the quality of evidence of these studies. And as you can see probably there, that this quality is very low to low. So it's true, according to the author's observation, that there was a small improvement in live birth or the ongoing pregnancy rates, according to these studies, if we culture embryos in a low oxygen concentration, but results are not really certain. So the authors themselves invite for having a more solid evidence available. And if we go back to the natural situation and we try to understand what is the physiological oxygen concentration in the female reproductive tract, beside the fact that these studies are extremely difficult to be performed, but then it seems that this is more or less the tendency, the values that have been reported, going from this value in the tube to very low level, around 2% in the uterus at the beginning of a pregnancy, to go up again by the 12th week of a pregnancy. So one possibility would be that we shouldn't culture embryos in a fixed, constant oxygen concentration, but maybe it's possible that we should go through a sequential oxygen concentration during our culture period. And actually, there is one study that is trying to analyze embryos in the two separate conditions. And the result that they reported is that apparently in the sequential oxygen tension, there is an improvement in the rate of utilizable blastocysts. So this is a possibility to be certainly investigated, because we are not definitely certain that the embryo are growing well in a certain condition of oxygen. So still some room for investigation here. And we cannot talk about culture condition without mentioning the culture media. We know now a lot about culture media. Laura presented very nicely today. But at the end of the story, what I wanted to say that several studies have been done with the different most used culture media that we have nowadays, trying to make different combinations. Again, these are, as she said, these are studies that are not easy to be done at all, because of the different conditions in the different comparisons in the different laboratories. But at the end of the story, there is no culture medium that has been indicated as the best one. So, beside the fact that there are messages coming out that can alert us, comparison between two media can demonstrate an advantage of one compared to the other. And not only this, but as we all know, there is the claim reporting that the culture media may have an effect on the perinatal outcome, not only on the IVF results, but on the perinatal outcome of children. I totally agree with Laura that this is not really easy as a result to be evaluated, because when we make comparisons, there are certainly confounding factors that are introduced. For example, the way we treat one culture media compared to another culture media in the same lab at the same time can be done not in the proper way. And we very well know that manufacturers, they recommend to use their medium in a certain way, under certain conditions, with determined plastic wear. So it's not so easy to identify which are the factors, beside the fact of the misinterpretation of the p-value, while we now know that it's extremely more important to look at confidence intervals than at the p-value themselves. So we are in a situation now that, okay, we have excellent results, but we are not really clear in which are the best conditions of oxygen concentration, as well as which is the best medium, the best safe medium. And this is something that we have to still work on. So one step forward, look at the selection systems. More and more, we are moving through from the point-in-time observation, from the static observation to the time lapse. I'm sure that you have seen many, many times this type of images, and it's certainly fascinating looking at them. But with this immediate to see, I mean, the first observation that we have, that there are different timings of events among the different embryos and, of course, among the different patients. So the time is now to really analyze all this tremendous amount of results and trying to understand which are, if they are, algorithm evaluating all these different timings that are really predictor of events of implantation. Not an easy task, again. Maybe the majority, there is more or less consensus on the fact that the time from the time that leads to the division to 5 cells is a critical point, but still there is more research to be done. So if I have to add another point for future research, for attention to next studies to be made, I think that it's important to try to evaluate which is the critical timing, identifying a correct division, and therefore being predictor of implantation. For us, selections criteria mean to try to be as less invasive as possible. Time lapse is certainly a form of very minimal invasiveness, as well as the techniques that are aimed at evaluating the metabolism of the embryo. This has been proposed a long time ago. The analysis of the spent culture medium has been tried repeatedly. Of course, it's quite logical. We know we have acquired a lot of information about the embryo metabolism, the embryo requirements for their growth. And I think it's quite reasonable, logical to postulate that the viable embryo has a unique metabolic fingerprinting. So when I heard for the first time the proposal of this system of the metabolomics to assess embryo development and therefore implantation, it sounded really logical to me. I was really expecting a fantastic application of this technique. And actually, it was based on the first result. When the studies were presented, we could see a real difference in the metabolic profiling of pregnant versus non-pregnant patients. Same consideration on the amino acid turnover, because this is also a reflection of the metabolism. Same consideration with the oxygen respiration rate that declines throughout the embryo development. The initial studies were able to demonstrate that non-fertilized oocyte and poor quality embryo have completely different respiration rate compared to fertilized and well-developing embryos. And again, a difference was shown between pregnant and non-pregnant patients, so embryos that gave rise to a pregnancy versus the others that failed. But unfortunately, and it was really disappointing to me, when these techniques were applied clinically, and I have here the example of the metabolomics, they completely failed to give a result, an advantage. And for me, it's really disappointing. I do not understand why. Maybe some technical problem that compensated negatively the possible advantage given by the technique, but we are still here waiting for an advance in this sense that, as I said, biologically speaking, I was expecting to happen. More recently, there was a proposal that came out that was really interesting to me, that is to evaluate the fluorescence of some substances that are naturally presenting in embryo oocyte and embryos, and that they have this property of emitting autofluorescence. So it is possible to develop techniques, spectral analysis measurements, to evaluate this capacity. And this is, again, in a study in which arrested embryos had a profile that was completely different from well-developing embryos. So this is also another possibility that it's worthwhile to evaluate, that may be combined with the other aspects of morphokinetics or other metabolomics evaluations, could give information of embryo viability. So I add, again, another point to the consideration that I was making. The new generation embryo, it would be good if it could be tested for embryo, for viability markers. Last point, I always was in favor of PGD, PGT, PGS, whatever you want to call it. And so I cannot avoid saying a couple of words. And PGS has been proposed many, many years ago, more than 20 years ago. And also in this case, as a biologist, I was expecting a tremendous advantage of applying the technique. Now it comes out that after so many years, only a very few number of randomized studies have been produced. I have to say that the one that had been published normally are in favor of the PGS, PGTA, I should say, group versus the control. I'm just going to show the result of the last study that is from Carmen Rubio from the EV group. It is a study that it is on day 3 embryos. It's very well done, very selected group of patients. And the conclusion of this study is that the analysis, the testing for aneuploidy is definitely superior in the control, in the group versus the controls, not only in the clinical outcome of the first embryo transfer, but also in reducing significantly miscarriages and then shortening time to pregnancy. I think that both factors are tremendously important for the couple, especially for the woman. And going back again to the matter of non-invasiveness, well, new data are now coming, maybe they are a little bit at the beginning, but they are now coming from the analysis of the blastocellular fluid, from the analysis of spent culture media, because both have been demonstrated to contain genomic DNA, mitochondrial DNA, RNAs, especially microRNAs that are so important in their regulation role, and proteins. So we certainly need to understand better the meaning of these factors in the place where they are, especially in the blastocellular fluid, or to perfectionate the technique when we are talking about the culture medium, because the spent culture medium, because of the problem of the contamination from the oocyte, from the cumulus cells. But I think that this is a very promising field for our future. So another point to be added, I certainly think that embryos should be tested for aneuploidy, at least in selected cases. And how can I mention, just briefly, the possibility of these tremendous new exciting techniques that is the CRISPR-Cas9, that is a technique, a very important tool in genome editing. Those of us that are making PGD since a long time, we have our tanks with so many embryos that the patient we will never have back because they have been diagnosed as affected or chromosomally abnormal. Now, with this technique, I see a future possibility of having these affected embryos by a pathology, a disease like, I don't know, thalassemia, for example, where there is a possibility of cutting the part in which in the DNA that the mutation is, and to replace it. This is genome editing that everybody says it is so scary technique because we are going to, well, modify the genome of an embryo. But as like everything, every tool, a knife can be very useful in the kitchen or when we go to the restaurant, can be very bad if we kill a person with a knife. So it's a matter of deciding which use to give to a technique, but certainly my hope is that the new generation embryo have a chance of being corrected for a mutation if affected by a pathology. And I'm sure that there are more points. I didn't mention certainly all the points that are to be considered in, when we talk of a new generation embryo. But I leave this to the new generation. I'm not talking about embryos now. I'm directly talking to embryologists, new clinicians and paramedicals that are coming after us. And you have a tough task to solve. I mean, keep going and try to be as brave, as strong as the pioneers that we had the chance to meet in these days, and to keep going. And I really hope that you will be very successful in your activity, as I think we were. And of course, taking the opportunity of thanking our pioneers, especially our host. And I also thank you for your attention.